Hi.
I'm Hannah,
I'm Lex.
and this is our Pharm roleplay project. Hi, my name is Perla White, and I am the patient today. I was born July 8th, 1984, making me 42 years old. My reason for coming to the clinic today is I've noticed my gums have started bleeding real bad, mainly when I brush them, but also sometimes when I eat, and I just know I'm overdue for a cleaning because it's been a while. I've got a couple things going on with my med history. I have type 2 diabetes. I was diagnosed with that in 2021 when I was 37 years old. I also got diagnosed officially with high blood pressure back in 2019, and I was officially diagnosed with anxiety back in 2010. And I also have an allergy to penicillin. Kind of makes me break out in a pretty bad rash. And I take a few medications every day to help manage my conditions. So the first one I take every day, twice a day, is 100 milligrams of metformin. That's for my diabetes. For my hypertension, I take 10 milligrams of lisinopril every day. I take 50 milligrams of sertraline for my anxiety every day, and I'll usually take 400 milligrams of ibuprofen as needed when I get headaches. As far as I know, I don't require any pre-med for any dental work. My last time at a physician was back in January. I went to my doctor, my normal doctor, just for a physical, Dr. Grant at Garner Family Practice. I have never been hospitalized, and I am not pregnant. I kind of already mentioned everything that was on this portion of the med history form they had me fill out, that drug allergy to penicillin, but the only thing on here that I didn't already mention is that I sometimes have acid reflux. I'll usually notice it at night, mainly after a day of drinking or eating a lot of fried food or acidic food like tomato sauce, lots of citrus like fruit salad, things like that. On this page, like I kind of mentioned, I do get frequent headaches. Not really sure what they're caused by, probably staring at a screen all day, but I would say around 2 to 3 times a week I'll get a headache, and that 400 milligrams of ibuprofen usually just knocks it out, or I need to go to sleep or something. So as far as my family history, my mom has diabetes, and my father has high blood pressure, and now I have both, so I guess there's a genetic thing going on with that. As far as the social history aspect, I do occasionally drink, and occasionally smoke weed on the weekends. I did smoke cigarettes for 10 years of my life, but I quit back in 2015, so 11 years without a cigarette feels pretty good. I'm not currently under the influence of anything. The reason I wanted to come to this clinic was, like I mentioned, it's been a while since I've seen a dentist or gotten a cleaning done. Probably about 2 years. It was probably back in 2024 last time I was. I don't really remember exactly what it was I had done. I don't really remember what x-rays I had. It might have been the thing that spins around your head, I'm not sure, but yeah, I saw a Wake Tech flyer at a local coffee shop, and I thought I'd want to try that out. I've been putting off going to the dentist because I don't have insurance right now, and I haven't always had the best experience at dental offices. I get really nervous during injections, and last time I went to the dentist, I had to get a crown on one of my lower molars. I think my lower left molar. So that was my last experience. I didn't really like it very much, so hoping to have a better experience this time. I just use a regular toothbrush. I don't have one of those fancy powered up ones. I use probably Crest toothpaste. I just kind of buy whatever's on sale. I do brush my teeth once or twice a day, probably closer to once. Um, I floss sometimes, usually when I feel something between my teeth after I eat. Uh, the only other thing I can think of that I use is maybe mouthwash. And like I mentioned, my gums have been bleeding real bad lately, so if I had to ask for any other information, it would be maybe something about that. And also, I've noticed that my mouth feels really dry sometimes. Like there's not a lot of saliva around in that, and it's not a real comfortable feeling. So I'd kind of like to learn a little bit more about that. I don't know if you would consider it health counseling, but my doctor is always telling me I need to eat better and cut down on the sugar. I do eat about 3 meals a day, and if I snack, it's usually on granola bars, chips, candy, fruit. I do love my sugar, so uh, as far as drinks, I'll drink water. I try to drink diet soda because I know it's not as bad. But I'll drink coffee and tea as well, and they're probably all sugary, but I try to do sugar free sometimes because I know I have diabetes, so I try to be good. Hi, I just wanted to pop in and kind of explain a little bit about why I created the patient profile that I did. I wanted this patient to be both dynamic but also realistic to what we would actually likely see in not only clinic but also in the real world. I chose her to have conditions like type 2 diabetes and high blood pressure because they're both really common and they both definitely have effects on oral health, as we know, especially the gums. That's why her main chief concern is bleeding of her gums. But I also added in the fact that she has anxiety and she takes a bunch of medications that can cause dry mouth. I just wanted there to be a bunch of factors at hand that were affecting her care. And then I tried to tie it together with like her habits of not only her oral hygiene habits but also her lifestyle habits, like years of smoking in the past, irregular flossing, frequent snacking, just to make her a more complete and interesting case for treatment planning.
Hi, I'm the dental hygienist, and I want to apologize for my voice. I'm not really sure what happened, but after Pharm, my voice just kind of went away for some reason. So I will be taking a lot of sips of water throughout this presentation, and I want to apologize for that. So, after reviewing my patient's medical history per the way, she has type 2 diabetes that is controlled in 2021. She has high blood pressure that's controlled in 2019. Generalized anxiety disorder, occasional GERD, and she's a former smoker of 10 plus years. She quit in 2015, excuse me. She is an occasional marijuana user and does occasionally drink alcohol. And she has a penicillin allergy where she receives rashes. Hi, this is me 2 days later. My voice is still not all the way, but it's better than what it was. I just wanted to come in here and kind of piggyback off of what I was saying, just because it was really funny, so I left it in there, but it wasn't as clear as I would like it to be. So I wanted to kind of reiterate everything. Um, Basically, I'm the dental hygienist, and I went over our patient Perla White's medical history, and a couple things stuck out to me. And what stuck out to me was that she has type 2 diabetes that is controlled with medication, and she was diagnosed back in 2021. She does have high blood pressure that she was diagnosed with in 2019, and it is controlled with medication as well. She has generalized anxiety disorder, she has occasional GERD, and she is a former smoker. She smoked for about 10 years but quit back in 2015. She is an occasional marijuana user and does occasionally drink alcohol. She has a penicillin allergy, and with that allergy, she gets rashes. So at Wake Tech, we make drug cards for our patients, and each patient is required to have a drug card just in case of a medical emergency. Also, that way we can know the different dental considerations as well as the function, class, and use of this drug. So, so we went ahead and made some drug cards for our patient Perla White. She is currently taking metformin, which the function of this is to increase blood glucose. It's an anti-diabetic and it controls diabetes. Some dental considerations with this is delayed wound healing. It can increase the risk of xerostomia. It can increase the risk of periodontal disease due to the diabetes of the poor wound healing, which also contributes to like any dental work that needs to be done, such as like an extraction. Um, she also takes sertraline, which inhibits the uptake of serotonin in the brain. It's an antidepressant slash SSRI, and it's used for anxiety and depression, which she does have generalized anxiety disorder. This medication can cause severe xerostomia. It can increase her bleeding risk, and bruxism is possible. She also has a high risk of gingival inflammation. She's also taking lisinopril, which lowers the blood pressure by inhibiting ACE and prevents the formation of any anticoagulation, I believe is what it says. And it's a class of a antihypertensive, and it helps with hypertension. Some dental considerations of this would be orthostatic hypertension, when we want to raise the chair slowly for her, and we want to lean her back slowly as well. It can cause xerostomia and dyspnea. I'm so sorry, my voice. Um, Ibuprofen, she's taking as needed. It inhibits prostaglandin synthesis. It's a drug class as an NSAID, and it's used for pain relief and inflammation, and for things such as like headaches and fevers. It does increase our bleeding risk. It delays blood clotting and can cause irritation. As you've noticed, a common factor amongst these drugs is dry mouth, and some do increase our risk of bleeding. So that is something we would want to make the patient be aware of during like OHI. Okay, so I also forgot to mention earlier that the reason why I'm doing a different slide is because I wanted to leave that stuff in because it was funny, but PowerPoint won't let me add two videos to one slide for some reason. So I apologize about the multiple slides. But anyway, so this slide is about drug cards, and as dental hygiene students, um, we at Wake Tech have to create drug cards for each of our patients. Our patients are required to have drug cards for every medication they're taking, whether that's a supplement, vitamin, whatever it is, they must have a drug card. And personally, I really like that, and I think that it's a great practice to have because one, it tells you about the dental considerations. You have that right on hand, the function, the class, and the use, and it's really good to know all that information, especially when going over OHI. You can incorporate the different medications, especially if they cause xerostomia or gingival enlargement. Those are important things that you want to talk about. But also the main reason why we do this at Wake Tech is for emergency situations. So when like the ambulance comes, we want to be able to hand them these cards and be like, my patient is taking X, Y, and Z. Here's the here are these cards. And so I think that's really good to incorporate into like private practice or like as my role. I'm a public health hygienist, so I think it would be really great to incorporate that. So we made some drug cards for our patient, Perla White. She's taking metformin, which the function of this decreases blood glucose. It's an anti-diabetic and it controls diabetes. Some dental considerations for this medication is delayed wound healing, and also with the diabetes that can also delay wound healing, possible xerostomia, and increased periodontal disease just because increased risk of periodontal disease due to the diabetes. She's also taking lisinopril, which is for her blood pressure, high blood pressure. It's an antihypertensive and it lowers blood pressure by inhibiting ACE. Some of these dental considerations we want to be aware of are orthostatic hypertension, so we want to raise the chair very slowly, probably lean her back pretty slow. We're also concerned with xerostomia, and this medication can alter her taste. Another medication she is taking is sertraline, which inhibits the reuptake of serotonin in the brain. It is an antidepressant slash SSRI. It's used for anxiety and depression, which makes sense why she's taking it since she has generalized anxiety. Some dental considerations is severe xerostomia. I believe SSRIs are a big drug class that does contribute to a lot of xerostomia. Her bleeding risk is increased, bruxism is possible, and higher risk of gingival inflammation. She is also taking ibuprofen, which inhibits prostaglandin synthesis, and it is an NSAID, and it is used for pain relief, inflammation, headaches, and fevers. This medication also does increase her bleeding risks. It delays the clotting effect after a procedure and can have GI irritation. Um, some pharmacological interactions with the medication that she's taking. We would want to inform her on these just in case her doctor or pharmacist did not make her aware of this. Um, Upon research, ibuprofen and lisinopril can actually decrease the effectiveness of her blood pressure control and increase kidney stress. So we would want to limit her to ibuprofen and probably would want to switch her to maybe Tylenol, possibly. Um, Ibuprofen and sertraline can increase her bleeding risk, which would be really important to note as she needed a deep cleaning, if she were to need an extraction, those would be some things that we would want to be aware of. Sertraline can cause xerostomia, which can increase her risk for caries. Um, Metformin can also cause a possible metallic taste that patients have reported in the past, but she does not report one. We would want to investigate that more when talking to her. Xerostomia and diabetes can increase her risk for periodontal disease, so we want to educate her on that. Okay, so this slide is talking about pharmacological interactions between her medications. She is currently taking both ibuprofen and lisinopril, but these two medications together can actually lower the effectiveness of her blood pressure control, which is really important and something we would want to bring up to her during OHI. Maybe see if she could try a different type of medication, maybe like Tylenol, possibly, just as maintain her blood pressure. It can also increase kidney stress. Um, Ibuprofen and sertraline can also have interaction. They both have increased bleeding, so that just makes her risk puts her at a higher risk than she already was. So maybe again, like I suggested, maybe switching her to Tylenol to help with headaches or anything like that of the reasons why she's taking ibuprofen. But she does take it as needed, so that's good that she's not taking it on a consistent basis because I don't think you'd want to take that on a consistent basis. But maybe, like I said, switching to Tylenol would be a better option for her. Sertraline, it causes xerostomia, which then therefore increases her caries risks, and that's something that we want to already lower because she does, have diabetes, which can contribute to that, and she does she does snack on a lot of sugary things, so that's something we want to, reduce so she doesn't have that high caries risk. Metformin can possibly cause a metallic taste, but she doesn't report one on her medical history, so I think I would just talk to her in OHI, see if she's reported anything like that. Metformin can also increase her risk for xerostomia, and then the diabetes can increase her periodontal risk. Okay, So some potential concerns for the patient's dental care. We would want to be aware of the periodontal risk because, like I said, she does have diabetes, and with diabetes, it can impair healing. And she's already reporting signs of that her gums are bleeding, and so that's something we want to be aware of because at the base level, your gums should not bleed. Unhealthy gums do not bleed. So with that, we know that she most likely probably already has gingivitis. And with that, knowing that, we would want to emphasize the importance of flossing. Of course, we'd have to do more in like her assessment to be able to gather like her probing depths and all of that information to determine if she did have periodontal disease. But with the diabetes, it does give her more of a increased risk for that. Excuse me. Um, she's also very inconsistent with her flossing. So again, we would emphasize the importance of flossing and how to floss during OHI. And her last cleaning was 2 years ago, so I would be almost confident in saying that this patient most likely does have a form of gingivitis, and we would want to get that under control as possible, as fast as possible. Um, Another concern is xerostomia. This definitely is coming from her medication. Sertraline and metformin have are a big factor in this. Also, with her marijuana use, that does contribute to the dry mouth. So having all of that, she most likely has a severe dry mouth, and we would have to talk to her about ways to supplement that saliva, such as like the lozenges or maybe um, drinking more water, stuff like that. But with that, all of the dry mouth, it can contribute to increasing her caries risk, making having more plaque buildup and especially discomfort, probably having more like having a harder time to talk and you know just being really uncomfortable. With her high blood pressure, although it is controlled with her medication, we would want to make sure that we are monitoring her blood pressure at every visit. Excuse me. Monitor her blood pressure at every visit, and we would want to be cautious with epinephrine if she did need any local or any local to numb her up. Um, I would stress to her that it is important that she continues to take her medication because high blood pressure is a systemic factor that can contribute to more disease in the mouth. With anxiety, we would want to consider that she is nervous for the injections, so we'd want to do the tell, show, do method, have a slow approach, explain to her everything we're about to do before we do it. Um, we could also offer things like a blanket, maybe CBD oil if we had it. Maybe we could dim the lights, put on some calming music, aromatherapy. We would want to do everything we can to make her comfortable. So, due to her medications and her dry mouth, she is at a high risk of caries. Um, and also, she does frequently snack on high sugary things and drinks as well. So, that is a contributing factor to her caries risk. So, some potential concerns for Perla White's dental care would definitely be periodontal risk. Because of the diabetes, she's already kind of at a risk for periodontal disease and she um, can have delayed healing. So she already reports bleeding gums and she's inconsistent with flossing and she's not very consistent with her cleanings, whether that's like due to insurance or whatever is going on. But obviously, it shows to me right now that she's not um, taking care of her gum health. And so, with that, I would just want to be aware in my assessment. I would want to be aware with OHI, teaching her how to properly floss. Um, so that way we can hopefully she has gingivitis and we can reverse it. If not, if she has periodontal disease, at that point we can, manage it and get her on a 3-month recall and all of those different steps. But another potential concern would be the xerostomia. I would really want to emphasize this in OHI and talking to her about her medications. Another thing is her marijuana use. I would ask her how many times a day does she smoke? Does she smoke just during the week? Does she smoke socially? I'd try to get more information on that. Excuse me. I would try to get more information on that because that can also contribute to dry mouth, xerostomia, which all of that can lead to increased risk of caries. Like I said, we want to keep that really low because, of course, we want to keep as many teeth as we can and not have to restore it with, non-tooth structure. We want our patients to have their natural teeth. And this can also increase her risk for plaque buildup, having a dry mouth. All of that stuff will just stick to her teeth, making her teeth more unhealthy. Her high blood pressure, we would want to monitor this at every visit, just because, like I said, with that interaction between ibuprofen and lisinopril, it can lower the effects of blood pressure. We want to make sure that we're still in a controlled level, so we're not maintaining our blood pressure. We also would want to be cautious with epinephrine if her blood pressure is elevated at that visit. And then we want to be aware, since she does have anxiety, she gets really nervous with injections. So we would want to do the tell, show, and do method, where we have a slow approach. We explain everything of what we're doing before we do it. And then we could also offer her comfort measures, such as like a blanket, CBD oil, or dimmed lights. Just do everything we can to make her comfortable, maybe like essential oils and stuff like that. Right now, based off of what I'm seeing, it sounds like her caries risk is high due to her medication, the marijuana use, and the frequent snacking of sugary foods and drinks. Okay, so as a public health hygienist, we do not work under a doctor, so this was what our treatment plan would look like. So basically, I would want to do a full assessment, which would include like typical medical history, her vital signs, especially with the high blood pressure. Also, with her medical history, I would want to make sure that her A1C is looking good and, it's not elevated, it's not in a range of dismissal. I want to make sure that she's at least eaten something about 90 minutes before the appointment. I will do EO-IO, of course, period charting, because I just want to get a better understanding of her gum health, since her chief complaint is about her gums bleed when she flosses, and that she doesn't floss. She's very inconsistent with that, and she hasn't had a cleaning in over 2 years. So I would be very concerned at that. I would also do plaque index if our office offered it. Personally, in an ideal world, if I had control in the situation, of course, I would love to do plaque index because I think it's a great tool for OHI. And my patients at Wake Tech really do love it, so I love it too. But then I would do OHI, especially emphasize on her flossing and teach her how to properly floss, and maybe recommend a water flosser depending on, her probing depths and how well she is doing with flossing. Then I would do Canberra to also include into her OHI and explain her high caries risk. Based on her medical history, I would like to prescribe 4 bite wings due to her not having x-rays done in about 2 to 3 years. I would also try to call and to get a pano, but if insurance would cover it, we would just get a new pano instead of getting her old one. Sometimes patients don't really remember what office they went to, but I think she put in her medical history that she does. But since we don't have any probing depths, radiographs, or calculus level, I'm sorry, my throat still hurts from not being able to talk, and it's really dry. Anyways, I would not be able to determine the type of cleaning she may need, but depending on the assessment, I would be able to further determine which one would be the best for her. During OHI, like I said, I would emphasize flossing and teaching her the proper technique with the C shape and which floss she uses, whether that's string floss or the floss picks, or maybe she just uses a water flosser. I would also maybe teach her how to use a water flosser as an adjunct therapy, maybe depending on like her probing depths and all of that stuff. I would also teach her the modified bath method, and maybe if she was interested, talk more about an electric toothbrush. I would also explain to her why her gums are bleeding during flossing. I had somebody explain to me one time that basically, like, your gums are like a muscle. If you don't really use them and you try to stretch them, they're a little sore. And then when you stretch them out, they finally feel a lot better. So it's kind of the same thing. Like, if you don't use the floss, if you don't glide in between your teeth, it's going to be sore, it's going to be bleeding, it's going to be uncomfortable. But when you continuously do that, it'll go back to normal and it won't bleed and it won't be uncomfortable. And I would also talk to her about zero stomach management, maybe increase her water uptake, maybe use like a sugar-free gum. We could use different lozenges that help with dry mouth. And then I would also possibly do a smoking cessation on her just because I could educate her on the different effects of marijuana and how it could contribute to her high caries risk and dry mouth and all of that stuff when she's already at increased risk due to her medications. I would also recommend fluoride for her and possibly a fluoride rinse based on her radiographs since she is at high caries risk. Thank you for listening to our project, and I hope you had a good laugh at my voice because it was really funny, even though it was really hard to record, but I hope you enjoyed it.